Good morning, Professor Dawn Langdon, and thank you so much for joining us here this morning.
It's an honour.
I would like to ask you a couple of questions about the survey that you did, which compares the perceptions of MSers and the perceptions of healthcare professionals in terms of care and management of MS. So, can you tell me a little bit about the survey?
So the survey was organised by MS in the 21st Century, which is a group of neurologists and people with MS and me. I'm a psychologist. And we have over 2,000 people responded to the survey, and we were asking them what they felt were the issues about communication and managing MS, which were the main barriers to optimal care. And interestingly, the healthcare professionals rated lack of time as a major problem. But there was also a strong feeling that communication was poor or could be better, and this was around the complexity of information about the disease-modifying drugs. It was around being able to talk about disease progression, which many people with MS really want to know about, really want to talk about, but apparently healthcare professionals find it slightly harder to address this issue. So it was interesting to see that there were these disparities between the barriers that were identified.
And what do you think were the main discrepancies in that? Which were the major ones that you think could be rectified, I guess?
Well, one of the main discrepancies was that people with MS were much more likely to say that there were communication problems than the healthcare professionals. And I think that puts the onus on healthcare professionals to start checking understanding, checking satisfaction in perhaps a more explicit and frequent way with the people with MS that they are speaking with. And then there were other differences around time available, perception of how much time was available, and also around these areas of disability progression and information about the disease-modifying drugs, risks and benefits.